Dr. Martin Hernandez, who's a specialist in pulmonary diseases, and he kindly agreed to answer some questions about emphysema.
Thank you for the opportunity, okay? It's a pleasure to be with you guys.
So, what caused this disease?
Well, first, emphysema. Emphysema is a disease of the lung, and sadly, it's a very common disease. The main cause of it is smoking. Cigarette smoking it really triggers many changes in our lungs, what is a destruction of the lungs. Any kind of fume that we breathe can damage the lungs. In fact, you don't have to smoke, but if you live with the smokers, you can develop the problems.
How serious is it, and how does it affect the patient's lifestyle?
Very serious, sadly, because it's kind of, you really don't see something that is coming and it's gonna get you, because people smoke and they feel happy, and obviously cigarette has the main problem that is very addictive. Emphysema means that our lungs lose its capacity to get the air in and out, and instead of having the normal, I will say, the normal physiology or function of the lung to inflate and deflate, the lung stays inflated, and it's trapping and trapping air, and it's not permitting to get anything else.
In this patient, what were the short-term and long-term prognosis for this disease?
Usually people get hooked, and they continue smoking all their life. And they will fine for many years till one day they start losing the capacity to breathe. First they start with a lot of lung infections, coughing and having problems during the winter time, and then later they are having problems to breathe all the time. At the end, it's a history that may take 30 to 40 years, and if somebody starts at age 15, 55, 60, they start having marked problems. And then one day they may finish requiring a wheelchair, requiring oxygen, requiring to be bathed, then impossible to go work, to have a quality of life with family, to travel, to do and enjoy many things, because slowly, but this is taking over all your life till you die.
What was the chief complaint that the patient had for consulting this particular patient?
The main reason was shortness of breath.
What other symptoms does the patient present?
When people feel like they are not able to breathe, and that's why they get short of breath, they start lacking oxygen, and they start losing weight and getting weak, because this is a chronic disease, and it's the fourth cause of death in the world.
How was the patient tested for the disease, and what do these tests reveal?
We basically do two things for this. We first look at the structure of the lungs, and that, sorry, X-rays and CT scans help us out to build these images and to understand how much of the lungs are damaged. But the most important part is function. This is a disease that limits function, and therefore to do pulmonary function testing is key. And we can measure that too, okay? With what you blow, measure inflammation, and we can measure if that tubing, because it's a piping, is obstructed. If the opening that it has been diminished. We do that with a spirometry. And we have found that they have very swollen bronchi, and then it's very hard for the air to come out, and it's like if you are breathing through a straw. If you try to breathe all your air through the straw, you're going to get tired. When that happens with a patient with emphysema.
What are the treatment options?
One is stop smoking. Second, when they need oxygen, to wear oxygen. Okay? To replace the oxygen that they are needing. Basically, everything else that we do can improve symptoms, can make them feel better for a while, but doesn't have a major change in the history of the disease. The other thing that we do for them, if they are young enough still to do it, is a lung transplant.
What treatment is the patient receiving, and how effective is it?
Well, first, the discussion and the support to quit smoking. Second, we started him on oxygen at home because he required oxygen 24 hours a day. Also, we use medication that we call bronchodilators. And he started improving, gaining weight and getting stronger and getting more active. He learned to have a portable oxygen and go out, in and out with his oxygen and have a better quality with the friends. Also,
What will happen if the patient doesn't get treated?
well, sadly, if they continue smoking and they do not wear oxygen if they need it, they pass away, they die. They get weaker and weaker and they get sleepy because of the carbon monoxide. And usually it's a very hard situation because you have to be very straight with them. And people that get critically ill, we need to put them on support devices, I mean, artificial. If things come to the point that they may require a breathing machine, that we are not going to use. They want to just have them with comfort, taking away pain and taking away any suffering, and have them with their families in order that they're ready to pass away.
And what new technologies exist for preventing, diagnosing, and treating the disease?
There is some medications that help you to stop smoking because it's very hard to do it on your own. But the most revolutionary thing that we have for this is long term. And it's kind of amazing technology, you know, to take out all these things on.
Well, that was the last question. Thank you for the interview.
No,
It was
a
really
pleasure.
nice.
Thank you.
Thank you guys. It's a pleasure to talk to you and help you.